Okay, guys, welcome back to the mailbag here. It's Dr. Sean again. We have a Facebook question here. This young lady's contacting us saying that her husband's on painkillers for his neck and back. He's lost the fluid in his back, needs surgery. He's worried that they told him that the surgery may not work. Right away, that's a flag. When you say, hey, you need this, but it's probably not going to work, you got to be a little bit cautious. Now, if it's necessary, it's necessary, but there's going to be other work that needs to be done here. Now, they're trying to work on a few things. He's on a bunch of medications. Apparently, his legs, they vibrate, they tingle. So he's got a neuropathy or a radiculopathy going into the legs. So where do you start with something like this? Again, you go back to that concept of examine, examine, examine. It sounds mechanical in its nature, so that's where you would begin. You'd look at the body just anatomically. X-rays, a must, probably an MRI to look for a disc problem. There are different techniques we do in practice that will kind of tell you if the disc is there or not, or what level it may be at, or where it may be irritated. But that type of therapy would be really, really good, or treatment or exam in this case would be good, just to kind of know what we're dealing with. Now, once you have this thing figured out, they're nervous and they're scared about surgery, and rightfully so. They're telling you, look, it may not work. I would find out the percentage. 10% it may not work, or 90%. That would be the first place I would start. And then when you go back with the work that we do, it's all about restoring normal function. For a joint to get into trouble, and the spine is joints, okay, it's the same thing. For a joint to get into trouble, the muscles that stabilize it, that hold all the bones together, have to fail. So if you were, for example, to take a skeleton and stand it up and let go of it and take all the muscles off, the bones would just fall to the floor. There's nothing to hold it together. It's the muscles that do all that work. So when you see something chronic like this in someone, where they're battling it, first you got to figure out, all right, what did it come from? Was it a traumatic accident? Was it an injury? Was it just normal wear and tear? How'd you get it? But once all that's done, and the history part's finished, now we're looking at just treating. You get in there and you start examining. And one of the things you'll find is that if you just put the anatomy back where it belongs, look for any abnormal parts that might be kind of wearing or rubbing together, or there's a friction point. Restore normal function, and that's done through adjusting. Now, once that's done, then you examine the muscles themselves. You have roughly 360 or so postural muscles, or what they call extrinsic muscles, muscles that hold you up against gravity. They have to fail to have this kind of problem going on. There's no way that they haven't. All right, well, if you don't reset those, if you don't get those muscles to re-engage and to do their job, it doesn't matter what you do. There's no therapy, there's no lifting, there's no surgery, there's no PT that will work for this. You've got to get the postural muscles to re-engage. Now, once you do that, now the pressure gets taken off the joints. And when you take the pressure off the joints, the pressure comes off the nerve. I would also use adjunct therapies here. 100% acupuncture. Absolutely acupuncture here. What style? You won't know until you see the patient. You got to get in there and say, okay, is it the traditional 5 elements that everyone likes to use? Probably not. It's probably going to be something a little more specific, a little more unique. But you get in there, and the acupuncture helps the body to break that pain cycle. See, when we have an injury or something for so long, the body pulls the fire alarm, and it's ringing, 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 ringing. Even though the injury may be gone, nobody goes and shuts the alarm off. So it just keeps ringing. Again, my analogy, the best one I can think of, is phantom limb pain. You lose a limb. Your hand still hurts. It's not even there anymore, but it still hurts because you pulled that fire alarm and the body created a feedback loop. Acupuncture helps the body to reset that feedback loop, to say, hey, look, the fire's over. Stop. Shut that down. And that's where the numbness, the tingling, the pain, that's where all of that can calm down. So once you rule out all the catastrophe and we get kind of an idea of what's going on here, you adjust. You then go through and examine all the postural muscles. Fix the ones that have failed. Use acupuncture as an adjunct therapy. And if you do that, you're going to have a really, really good chance at restoring your life and getting your normal function back. And that's probably without surgery. If there's something major there, we can deal with it. But even after surgery, they still don't fix all those things. They have to be dealt with. If they're not, you'll never feel it get better. That's about how this works, guys. It's restoring normal function, helping you to get your life back.